Monday morning, and November is Men's Health Month. For those of you who are growing a mustache, Movember, that is to bring awareness specifically to prostate cancer. If you're not shaving at all, you're bringing attention to men's health overall. But we do want to talk about prostate cancer and which men are at risk, which men are more at risk, and what steps they should take. Dr. Andrew Sun is with Texas Urology Specialists, and he's joining us live this morning to run down this for us. Dr. Sun, thank you for being here.
Thanks. It's great to be here.
Give me a sense, if you will. We've just seen the headlines play out as of Friday, I believe. Al Roker acknowledging that he is suffering from prostate cancer. He's been diagnosed. He said in one of his posts that it was a bit aggressive. What do we think he means by that?
So prostate cancer is very common, and it's the second most common cancer in men in the United States. It affects about 1 in 9 men throughout their lifetime. And there are certain groups that are more at risk, African American groups being one of them, which tend to have more aggressive prostate cancer.
Why is that? Why are African American men, again, something Al Roker spoke to, the number is something like, is it 1 in 7 as opposed to 1 in 9?
Correct, yes. You know, the data show that not only are African American men more likely to get prostate cancer, it tends to be more aggressive and the outcomes tend to be worse. There's part of that is genetic, predispositions, and certainly there's probably a part of that that's, access to care and whatnot as well.
Well, there's access to care, and there's also willingness to seek care, even people who have insurance, and especially men. This is a theme that has played out for a very long time, that men are less likely than women to take the proactive steps they need to do preemptive care, whether it's colon cancer screening or prostate cancer screening. So let's send that message home as best we can. What should every man do when it comes to detecting prostate cancer, and at what age?
Yes, indeed, absolutely. The men, we're relatively more resistant to going to see the doctor. And part of the whole campaign of November is to make it okay, to normalize the conversation for guys to come and see the physician more. In terms of prostate cancer specifically, we generally recommend that starting around age 55, men should have a routine PSA, that's a simple blood test, drawn to check on their status. But for men who have higher risk, whether that's because of a positive family history or, as we discussed, in African American men, we advise screening earlier, even as early as age 40.
Okay, so almost running parallel with some of what we've heard with colon cancer. Like in my case, it runs in my family on both sides, so I got my first screening just after 40, when normally it would have been after 50, and they detected a precancerous polyp, which over the course of 10 years could have become much worse. You're saying the same thing about prostate cancer if it runs in the family.
Exactly. And that's true for many things. When you have a family history, it just means that you're more likely to get it, and therefore you should move up that screening schedule a little bit earlier.
Okay, is there not a blood test that has an indicator that lets you know a certain level is up, and therefore you should take another step for a screening?
Right, exactly. It's called the PSA, prostate-specific antigen, and that's the blood test that we use. Usually you just get it drawn once a year, usually at your primary care doctor as part of your sort of normal physical.
So I think it's important we stress that, because to be screened for prostate cancer is simply a blood test. If that indicator is there, that PSA, then you take the next step. When you move forward to that next step, if you catch it early, what is the rate of survival versus if you catch it later or if you ignore the early signs?
So fortunately, as long as you catch it early, and most of the times it is diagnosed early, 5 and 10-year survival is 95 to 100% with our modern therapies. Of course, if you don't, then the equation changes. But certainly it's a very treatable cancer as long as we're being aggressive and getting at it early.
Yeah, and one interesting point here, when you talk about family history, if you have men in your family who died of other causes and were never diagnosed perhaps with the beginning stages of prostate cancer, you may not know if it runs in your family. So to that point, maybe be a little more mindful. Ask your doctor about the PSA level even earlier than 55. In your 40s, start the process. Thank you for joining us, Dr. Sun, Dr. Andrew Sun. We really appreciate it.
My pleasure. Thanks very much.
Some good information. Hey, Jenny, you listen, get a physical too, even though it's We put it on you because we want you to tell Heath it's time for him to get his annual physical.
I was just, Ron, I kid you not. This interview, I don't think you're going to realize how impactful this was. I was just texting him, and I hope that others are doing the same, like saying, hey, you know what? I know we've all been kind of holed up for a while, but we do still have to get these screenings and visit the doctor. Thank you
like,
for that
for
segment.
example, my grandfather died of colon cancer, but we don't know, did he have prostate cancer if he'd not been screened for it?
Yeah.
Where is it in our family history? So again, TexasUrologySpecialists.com together with the folks at Boston Scientific. They're edcure.org.